Hello, everybody. I'm Harry Guiremand, and I'm talking to Michael McGrath, a Navy veteran who has a story to tell about what happened to him in the Navy. He was born intact and was cut under false pretenses, and this was a major violation of his body and rights and medical malpractice. And Michael's here to tell us about what happened to him and give people an idea of what's actually going on with doctors who abuse their power. Anyway, this is Michael McGrath. Hello.
Hi. Nice to see everybody. Good afternoon. My name is Michael McGrath. I live in Conifer, Colorado, at 8,330 feet in altitude. I have a beautiful house, and I'm just enjoying myself. I was born in Poughkeepsie, New York in 1956. 1956 was the year the medical industry officially changed the oxygen levels for premature children that were born. Prior to 1956, many of the children that were born were given too much oxygen, and they ended up blind. So I was very lucky to be born with my twin sister in 1956. But my twin sister and I were a failed abortion, and we were kept alive in a preemie unit in upstate New York. I was severely jaundiced, and I was born with bronchial asthma, so I was placed in an oxygen tent for the first 6 months of my life in the hospital. Sorry.
Yeah, that's pretty heavy stuff. And your sister turned out okay. Was her health good after all this?
She was in the hospital for a very long time too, because we were so premature. It was ridiculous. I don't think we were longer than my hand.
Wow.
And I don't think we weighed more than 2 pounds. So, because I had bronchial asthma and I was severely jaundiced, they considered me an at-risk. Besides the fact that we were so premature, they decided not to do a circumcision on me. My father was circumcised, but they left me intact. And I was very happy about that. But I didn't know anything about circumcision because I wasn't cut. So it was like I was the oddball out, but I never was teased in school, which I hear is very unusual for men that were in my era anyway, that grew up taking showers in high schools and stuff like that. People were teased if they were still uncircumcised.
So that never happened to you?
Never happened to me, no.
Oh,
I was picked on for just because I was the smallest kid in class, so my penis didn't matter. So it's kind of weird, but so I joined the Navy right out of high school in 1874 on the delayed entry program, and went to my first tour of duty was in London, England. I was there for 2 years. I met my first wife there, a British citizen living in California, and I was living in London. She was on vacation visiting relatives. So we wrote back and forth after she came back to the States. We wrote back and forth, and I flew directly to California. We got married 2 weeks after I got back to the States. We had twin daughters that were 2 months premature in 1977. So I'm a twin, and I have twins. Twin daughters. So I didn't have to worry about circumcision issues.
They surely would have pushed it on you if they could have.
Yeah, they would have. And I probably, with the ignorant mind that I had, would have said, sure, I don't know. But because my twins were 2 months premature, the gynecologist my wife was seeing at the time said to me there's a good chance that my twins were born premature because I was uncircumcised.
And that was just how it seems quite amazing that she would make that statement. And did she back it up with any reason, or yeah?
No, no, did not back it up. And she said, if we wanted to have more children, I would need to be circumcised.
And did you have any sense of that maybe the wool was being pulled over your eyes, or no?
No, I don't know what I was. I was too stupid.
Well, you trusted authority, like most
Trusted
people do.
authority. Yeah, I did. Yeah, I did.
I mean, that is the real crime of abusing one's authority. Is it just people trust you, and then it gives them power to operate almost unchecked.
Yeah, yeah. What was really strange was that I went in for my appointment for the circumcision, and they had me scheduled for a vasectomy. And I was like,
instead of the circumcision, or in addition to
the circumcision, and I was like, no, that's not what was supposed to happen. We're trying to have children, not trying to have children. And so I was like, oh my gosh, what am I getting myself into? So
I mean, you kind of lose confidence in the professionals at that point.
I was beginning to. And what was very interesting, now, forgive me, but I trust Navy corpsmen before I'll trust a lot of doctors. And that's who operated on me for my circumcision. But I thought it was very odd that there was no doctor in the room. I had 2 Navy corpsmen that did the circumcision on me. It was a local anesthetic that they used. They shot the needle into the head of my penis, into my glands. I still have a purple scar from that to this day. They did a very interesting operation where they cut it and clipped it back and sewed it down. I don't remember seeing them cut any flesh off. So I don't know. Another friend of mine that I was stationed with had also been circumcised by the Navy, and they gave him his foreskin in a jar with formaldehyde in it. They didn't do that to me. So, but right after the circumcision, my life fell apart. It was as if, now I'm an adult survivor of childhood, adverse childhood experiences.
Can I ask a question? When you talk about a corpsman, is that equivalent to a nurse or an EMT, or what would be in the civilian equivalents to a Navy corpsman? Or is there anything?
I'd say a nurse or a physician's assistant, but usually physician's assistants they have a higher degree than lower. But I mean, it was enlisted. See, doctors in the Navy, in the military, are officers, so they've gone to school, got their degrees, and joined the military. Most corpsmen are enlisted. They have to go to school for that particular job when they join the Navy. And from what I understand, it's rather extensive, and they learn a lot. But their experience is much more practical than some of the doctors' experiences. Most of the corpsmen, when they're sent into battle, into combat, and they're on the front lines and they're saving people's lives, they get that practical, hands-on stuff going on, and they're more apt to be trusted than some of the doctors are. But anyway, so
yeah, thanks for clarifying that. I just for people who don't have the point of reference, it's having surgery done by someone who's not a doctor seems unusual, but I mean, this guy was trained to.
Yeah, there were two guys. They're called hospital corpsmen in the military. HMs is the acronym for them. So anyway, they seemed like they knew what they were doing. But I still can't figure out why they didn't give me my foreskin in a jar. But it was very, very painful to get the needle to begin with. It sent me literally, I was like this in my chair because it was, no preparation for that. That was
But
the first.
during the procedure, that the anesthetic was sufficient that you didn't feel anything.
Right.
And then after the anesthetic wore off, what was the pain like? What happened?
They give you these capsules that you break open if you should get an erection at night while the wound is still healing. And so there were stitches all the way around the shaft of my penis where the site of the operation was. It was bandaged up. I was told that if I should get an erection in the middle of the night or whenever, that I could break these capsules open, ammonia capsules, and it would make the erection go down.
But it wasn't a painkiller.
They gave me painkillers too.
Yeah.
I'm not one for popping pills.
Yeah. Yeah. So was the pain intense during that time, or? Yeah.
Yeah, it was. It was like, So when I got an erection, the pain was like, okay, get this. Where's the ammonia capsule? I have to have it in my pocket or close by, because it had to. I couldn't have an erection.
Right.
The pain would be too much.
And were you already having second thoughts that maybe this was a bad idea at that point, or?
Not yet. Because I still believed the doctor, the gynecologist.
Right.
And I thought that the sensitivity level would increase and, but that isn't the case.
You thought things would go back to normal.
Yeah, I thought they would go back to normal.
Yeah.
And they don't.
Right.
They don't. They progressively worsen. As an intact man, having a foreskin until I was 25 years old, I look back on that and I go, what in the world did I do? I feel like I violated my body by allowing somebody else to do that to me. That's what I feel like.
Okay.
And I can't help looking in the mirror and say, Michael, what were you thinking? What were you thinking? You should have done your homework. You should have done your homework. It changed everything. It changed sex. It changed the relationship with my wife. It changed the way I thought about myself. My confidence level was already in the gutter to begin with from my upbringing. And if it hadn't been for God and my relationship with Him, and my relationship and my religion, I'd be dead right now. I would have committed suicide.
And that's not the first time we've heard that. There are men who do commit suicide after they've been cut as adults. It happens.
I've tried doing foreskin restoration manually. It's been very, very long and complicated and difficult. I did know a friend who restored his foreskin in 9 months with a balloon and a tire inflator. And I was very impressed with the progress that he made in that regard by using that technique. But I still can't get over the industry. And the more research I did about circumcision, the more shocked I was. I was shocked. I was like, you are kidding. All the way from Mr. Kellogg to now. I don't understand it. I understand why they were doing it, but it's unethical. It's all a lie and it's all unethical. Every single bit of it. You have to have had an extreme phimosis in order for a circumcision to even have been thought of, and then there's always other options. But circumcision is not the end-all solution for all the things they say it is.
It certainly doesn't prevent premature births. I mean, it's just like
uncircumcised men. Uncircumcised men have been fathering babies for centuries since the beginning of time.
Right.
We would have been extinct by now if that was true.
Yeah, it just doesn't hold up to logic, but that doesn't stop them. They don't care.
They don't.
Yeah. And it's it's corrupt.
It is corrupt.
Just very corrupt.
Now, the sensitivity issue was when people say it doesn't affect the sensitivity issue, I will be the first one in line to tell you that is not the truth. My uncircumcised penis was way more sensitive than my circumcised penis. And it wasn't the glance issue. It's the foreskin. The foreskin being, by the time you're an adult, that size of that piece of skin is 3-inch by 5-inch piece of skin. That is it is the most erogenous external tissue on a man's body. And why would you cut it off? For what reason would you cut it off unless it's for money? And I think that's what it was for.
Or pure sadism. It's just...
Well, they get a chunk of change for every foreskin they provide, because I understand that one foreskin provides enough skin cells to fill a football field.
Right. They grow, each cell that can be grown to like a 3-inch in diameter disc when they do cultured skin, when they produce cultured skin from foreskins. And so and each of those discs is worth $300 or something like that. So, clearly it's very valuable.
Yeah.
Yeah.
It's greed. It's greed, and I think it's a deception. I just think, from my perspective, it's a deception, a purposeful one.
One thing we often hear from guys who are cut at birth, who are trying to defend what happened to them, or in denial that they were harmed, they will say, "Oh, I couldn't possibly stand any more sensitivity. I would go insane if I had any more sensitivity." And it's like, no, your experience doesn't match that.
No, it doesn't. It doesn't match science either.
Yeah, it's complete. But I mean, they're clinging to whatever justification they can find, because the pain of realizing that they were harmed by the people who should have been protecting them.
Right.
It's so devastating that they would rather cling to any little bit of floating debris to keep them from drowning in the pain that this horrible thing happened to them, and the people that they loved and trusted betrayed them.
Yep.
It's just such a hard thing to get over.
Right.
And as you know from your own experience, it's just such a deep wound.
What I am very thankful for is my father, who agreed to keep me intact because of my condition. But the way that he didn't, when I was old enough to talk about circumcision, he didn't force me to get circumcised. He just left me intact. And then when I was between the age of 10 and 13, he instructed me how to clean myself. And it was just very kind about it. And that I'm very thankful for. And I'm very thankful that he didn't take me back to the hospital and let the doctors circumcise me. But I look back now and it's like, well, all for naught. So, I mean, I have a bit of shaft skin from my attempts to restore. So,
and how long have you been working on restoration?
Since 2001.
Yeah. And consistently, or just on again, off again? Yeah.
On again, off again. On again, off again. Sometimes I'll pull the shaft skin over the glance and tie a rubber band around it, but then that little bit of skin underneath that rubber band starts to turn blue, and I realize I've got to take this rubber band off. Because I like the feeling of my glands being protected. That's what it was. That's what a foreskin does. It protects the glands, because the glands is the male version of a clitoris. And what woman would want her clitoris rubbing on her clothes all the time?
Right.
No woman would want that. And so, it's and for those men who are thinking about circumcision, who end up watching this video, don't. Whatever you do, don't. Just leave it alone. Let what God gave you let it be. Just let it be. There's no reason to cut it off. No reason.
Right. That's the voice of experience. I mean, you know what you're talking about. And there's no authority that can outweigh your experience.
Right. None. They can try to refute me all they want to, but I remember what my foreskin was like. There are days when I actually have phantom foreskin issues. You know, when a person has part of their body amputated, they have a phantom arm issue or a phantom leg issue. And they think it's still there. So they look down to see if their leg is still there, or look down to see if their arm is still there, because there's the brain issue. And often, because it's not external, it's hidden by clothes, I have to run to the restroom to see if my foreskin's back, because it feels like it's back.
Wow.
And then I look, crap.
And did that happen consistently since then, or is it?
Yes, It's happened consistently since then. And yeah. And
so that's got to be another shock, another kind of another reminder that you lost something.
Yeah. And stop it. That's what I say. Just stop cutting little boys.
You mentioned that you had some unusual sexual behaviors after the circumcision. Is that something you want to talk about, or would you rather, or it's not rather?
I'm just going to say that things I had never thought about doing prior to the circumcision, I started doing after. And I thought that I was going crazy. Thought I was losing my mind. And I didn't really connect it with the circumcision trauma. And most people don't realize that when you have something amputated, it is traumatic to your body. Whether it was an easy operation or not, it's traumatic for the body to be missing a part of itself. And so the brain itself reacts to that amputation.
Right.
And I didn't realize that for many years. Dr. Van der Kolk wrote a book called The Body Keeps the Score. And my therapist, my VA mental health professional, recommended I read that book. And it was probably the best thing I could have ever done, because he has scientific proof over a 30-year period of study that any kind of trauma that a person experiences in their life, your body holds on to that trauma. And the only way to help get rid of that trauma is prayer, meditation, yoga, art, music, because your amygdala flares up. Your amygdala is one of the glands underneath the base of your spine, your brain, at the top of your spine, and it's your fight or flight mechanism, and it inflates when it experiences trauma. And what I realized many years later was that my amygdala was still flared up. I have PTSD to begin with from my childhood, and then I had the circumcision, and that was traumatic, and all the stuff I went through in my first marriage, very, very traumatic things. And my behavior was all over the map. My sexual behavior was all over the map, which prior to the circumcision, it wasn't. I didn't even think about it. I just thought about I was monogamous, heterosexual. That's what I was. And I was happy being that way until after the circumcision.
And how long did it take before you realized that the circumcision was the triggering event that caused these other behaviors?
20 years. Yeah, 20 years.
Yeah.
When I started putting the pieces together. I was going through EMDR when it started making sense.
EMDR is?
Eye movement desensitization and reprogramming. It's a stupid scientific name for the best therapy a person can go through who's dealing with trauma in their life. It's electrical leads that basically reconnect the two hemispheres of your brain, and wherever your memories are stored, it reawakens them, and it doesn't in a non-traumatic fashion. So it doesn't re-victimize you or re-traumatize you. And it's just all the pieces of the puzzle just started fitting together. And I was like, well, no wonder you allowed them to cut off your foreskin when it didn't need to be cut off. And your body's trying to compensate for that. Your whole body is trying to compensate for it. I mean, my therapist says that a lot of the artwork that I do, about 50% of it is male oriented. And she said that's part of your trying to get reacquainted with that which you lost. And it's true.
Makes perfect sense. Yeah.
Your body's like, well, number one, it's grieving. And number two, it's trying to reassimilate that which you lost back into itself. And it's just, as weird as that might sound to some people, it makes perfect sense to me from my experience.
So you went through stages of grief, like denial, anger, all of those things?
Yeah, but I didn't know that it had anything to do with the circumcision at first.
Right.
I mean, I was trying to figure it out. I'd wake up in the middle of the night just in tears.
Right.
They got enough stuff to deal with in my life where I have to cry over. I just didn't know what I was crying over at the time.
Right.
So I look back and I go, okay, yeah. I mean, even the Apostle Paul writes into the church in Galatia that he says, those people that are trying to force you to get circumcised, I wish they would also get castrated. And
yeah, it's pretty strong statement.
Pretty strong statement.
From a religious leader, yeah.
Yeah, he was like, don't do that.
Yeah.
Don't do that. If you were uncircumcised when you came to Christ, then stay that way. And that was a slap in the face for me.
Right. It's yeah.
Yeah. I appreciate you letting me share my story.
Yeah. Is there anything else you'd like to add?
Yeah, those of you who end up having boys, fathering boys, do not let the doctors do anything to your boys' foreskins. Period. Do not let them touch them. Period. Do not. It is a violation of those little boys' bodies. They have no say in it, and that boy's body is not your body to make a decision about. That body is separate from yours. Let that boy decide for himself if he wants to be circumcised when he is of age, and if he needs it. Do your homework. Don't just let the doctors tell you the BS that they tell you, because they're in it for the money or whatever they're in it for.
Right. Well, Michael, this has been such an important interview, and I'm so glad we had a chance to talk. And if we ever get a chance to talk again, I'd be happy to learn more from you. It's been very instructive.
Thank you very, very much. I really appreciate it, Harry.
Okay, thank you for talking to us. And this is Harry Guiremand from Bloodstained Men wrapping up. And this is Michael McGrath from Colorado and his story. Thanks. Thank you very much.
Thank you for having me. Take care. God bless.
Okay.
Bye-bye.
Bye now.